Assalamu alaikum everyone, I'm Reem and today we'll be discussing the venous drainage of the lower limb, both the superficial and the deep veins as well as their clinical relevance. Starting off with the deep veins, we have the femoral vein, the popliteal vein and its tributaries, the tibial vein both anterior and posterior, the fibular vein, the soleal veins, the dorsal venous arch, the medial plantar vein and the lateral plantar vein. So before we get started, I would just like to clarify a point, which is that the veins are on the contrary of the artery, meaning that they're gonna start on the distal part of the limb, which is like the foot in the lower limb, and then they're gonna continue upward into the trunk. So now we can begin with the femoral vein. The femoral vein is the vein that I'm just pointing at here with the arrow, which is the continuation of a lower vein, which is the popliteal vein. So as the popliteal vein descends upward, after it passes the adductor hiatus, it's going to become the femoral vein. Now the femoral vein is going to lie in the anterior compartment of the thigh, and it's also going to occupy the intermediate compartment of the femoral sheath. Now, the presence of the femoral vein is in the intermediate compartment is not just a coincidence, but rather than to provide the femoral vein with like some sort of help, as the femoral artery is going to pulsate, it's going to help the femoral vein move the blood from downwards to upwards against gravity. And after the femoral vein crosses the inguinal ligament, which like usually is like here, it's going to become the external iliac vein, and then it continues upward. Now the femoral vein is going to give an important superficial branch, which is this branch right here, and it's called the great saphenous vein, which we will discuss later. Now moving on with the popliteal vein is the vein right here. I'll zoom in so you guys can see. So this is the popliteal vein. Now the popliteal vein is formed by the fusion of the anterior and posterior vena comitants that are like accompanying the anterior and posterior tibial artery. So the anterior and posterior tibial artery are going to have like some sort of vena comitants, and as these two vena comitants are going to fuse in the posterior compartment, they're going to form the popliteal vein, and then the popliteal vein is going to ascend upward into the popliteal fossa and give some tributaries. After it gives some tributaries, it will move upwards into the adductor hiatus and become the femoral vein that we just discussed a while ago. Now, moving on to the tributary, as I just told you, you know how the popliteal artery is going to give like genicular branches to the knee joint, so does the popliteal vein. So it's going to give like corresponding branches to the arteries of the popliteal artery in the knee joint, but it will also give a superficial branch, which is the small saphenous vein, which we'll also talk about later. Now moving on to the anterior compartment of the leg, this vein right here is going to be our anterior tibial vein. The anterior tibial vein is going to extend like almost the entire length of the anterior compartment of the leg, and it's going to drain the anterior compartment of the leg. It will be present between those two bones, which is the tibia and the fibula anteriorly. On the posterior on the posterior part of the leg compartment, we have the posterior tibial vein, which is the vein right here. The structure right here is our posterior tibial vein. It also is present in the posterior part of the leg between the tibia and the fibula, and then as I just told you, the anterior and the posterior, they will fuse together to form the popliteal vein that is going to continue upwards in the popliteal fossa. The posterior tibial vein, as its name suggests, it will drain from the posterior part of the leg, or like the posterior compartment of the leg. We have a lateral vein, which is called the fibular vein, sometimes known as the peroneal vein. The peroneal vein is also going to accompany the peroneal artery. So it's like a general rule that most of us know, that veins are going to accompany an artery. So the fibular vein is the vein like this one right here, is going to be present on the lateral side of the leg, and it's going to drain from the lateral compartment of the leg and the lateral compartment of the foot. Moving on to the soleus plexus. The soleus plexus, as its name suggests, is going to lie within the soleus muscle. We know that the soleus muscle is a muscle of the posterior compartment of the leg, and it's going to have a great force. So this picture right here is showing you how the soleus plexus look like while we're standing. You can see that there's like kind of some sort of a high pressure that is exerted on these plexus. However, once the soleus muscle is going to contract, it's going to press on both sides of the veins, and thus it's going to help the vein move the blood from downwards upwards against gravity. And then ultimately the soleus plexus is going to drain into the posterior tibial vein. Moving on to the foot, we have two sides, which is the dorsal aspect and the plantar aspect. On the dorsal aspect, we have something called the dorsal venous arch, which is kind of similar of the dorsal venous arch of the upper limb that is present on our hand. As you can see, it lies overhead the metatarsal bones, and it's also lies in the subcutaneous tissue. The dorsal venous arch is formed by the fusion of the deep veins of the different toes. So you can see the big toe, the second, the third, like each one of them has a deep vein, and this deep vein, all of them, they're gonna fuse together and form this some sort of semi-lunar or semicircular structure that is called the dorsal venous arch. Now the dorsal venous arch is going to have like two continuations. On the medial side of the foot, it's going to continue as the great saphenous vein, and on the lateral side of the foot, it's going to be the small saphenous vein. Alright, moving on to the plantar aspect of the foot, we have the medial and lateral plantar vein. The medial and lateral plantar veins are also going to accompany the medial and lateral plantar arteries, and then these two veins are going to fuse together, or they're going to unite together behind the medial malleolus. So this is the medial malleolus of the tibia. Behind it, you can see they're going to unite together, and they're going to form the posterior tibial vena comitans, which is going to continue upwards as the posterior tibial vein. Okay, now moving on to the superficial vein. In the lower limb, we only have two superficial veins, which are the great saphenous vein and the small saphenous vein, which we're going to discuss in details now. Now, looking at this picture right here, we have the great saphenous vein. So the great saphenous vein, which is the entire long vein, is going to be a branch of the femoral vein, and it lies on the medial side of the leg. So if we were to imagine like all of the muscles, this would be the medial side, and this would be the lateral side. So the great saphenous vein is going to lie on the medial side of the leg. It passes anteriorly to the medial malleolus of the tibia, then it moves upwards and then passes posteriorly to the medial condyle of the tibia, and then continues upwards until it's going to drain into the femoral vein, because superficial veins will always drain into deep veins. However, as the great saphenous vein is going to enter through the femoral vein, it's going to pierce the deep fascia of the thigh, which is fascia lata, and there's going to be a small opening called the great saphenous opening. It's going to enter through that opening and ultimately draining into the femoral vein. Now, moving to the small saphenous vein, which is a branch of the popliteal vein. The small saphenous vein is the vein that lies right here, and on the contrary to the great saphenous vein, it lies on the lateral side of the leg. It's going to move posterior to the lateral malleolus of the fibula, and then it's going to drain into the popliteal vein, and then the popliteal vein will ultimately drain into the femoral vein. Alright, now moving on to the clinical relevance of the veins of the lower limb. We'll first start with the varicose vein. Varicose vein could happen to multiple causes, ranging from old age, obesity, pregnancy, heredity, or like a problem within the vein itself, such as weakness of the vein walls, incompetent valves, or it could be from elevated intra-abdominal pressure as a result of multiple pregnancies or abdominal tumors. Now, what happens in the varicose vein, we all know that the veins kind of have valves, and those valves, they have like a specific like they're close to each other to open and close and allow the blood to move upwards. So they're gonna close when the blood is moving upwards to prevent the backflow of the blood. What happens in the varicose vein is that the vein is going to widen, so the space between the two the valve is going to be enlarged, and thus is going to allow the blood to flow backwards, and this is going to be the condition of varicose vein. It's most commonly in the superficial veins, and in the leg we have two superficial veins that we just discussed, which are the great saphenous vein and the small saphenous vein, but luckily we do have a solution to it. I think it's corrected by surgery. Now, moving on to the clinical importance of the veins of the lower limb, they could be used in multiple cases. So the femoral vein is one of the commonest sites that is used for gaining central venous access during emergency cases, which they're going to perform vein cannulation. Vein cannulation is a process by which they're going to insert a cannula, which is like a plastic, some sort of tube that they could collect blood with. They can administer fluids, or they could also administer medications, depending on varying on the situation, but it's usually or ideally used in emergency situation. Moving on to the great saphenous vein, many patients do suffer from occlusive coronary diseases, and the great saphenous vein is an ideal graft that is harvested from the lower limb, and it is used as a coronary bypass to provide the heart with an external source, because the coronary arteries, they are obstructed due to atherosclerosis and such and so on. So what they would do is that they're gonna harvest the great saphenous vein and bypass those obstructed coronary arteries and provide the heart with blood that is required to prevent further complications of the heart. Now, we all know that veins internally, they have some sort of valves, and those valves, if they were present, ideally they're gonna obstruct the blood flow. So some of you guys would wonder, how is that happening? How would that solve the problem of coronary bypass? What they are gonna do in this situation is that they're gonna flip the vein inside out, making the valves lying externally, and the soft lumen is going to lie internally. Also, the great saphenous vein could be used to bypass obstructions not only for the coronal arteries themselves, but rather the brachial and the femoral arteries. And then finally, with the last clinical relevance of the lower limb is DVT, also known as the deep vein thrombosis. Deep vein thrombosis happens when the vein, when the blood within the vein clots. So it forms like a clot, or could even, this small clot could travel and form a pulmonary embolism, which is a more serious complications. This usually happens when there's immobility, surgery, or medical conditions in which the patient is not been moving. So in case of the soleus plexus, and because they're subjected to a huge amount of pressure, and with the patient being laying down the entire day, the veins, the blood within the vein itself are gonna form a clot. The clot initially could stay within the vein itself, or could travel somewhere else in the case of the lungs and form pulmonary embolism. Okay. So now we're going to go over the entire drainage of the lower limb, and we're gonna start from the foot, because it's the origin of the all of the veins that are gonna extend upwards into the anterior and posterior compartment of the leg, as well as the thigh. Now, as you guys can see here, that every single toe is going to have the straight vein that is coming into, or emptying into, the dorsal venous arch. Each and every single toe is going to have these deep veins of the toes, so they're called the deep veins of the toes, that are going to empty into this dorsal venous arch. Now, the dorsal venous arch is going to empty into 3 veins. 2 of them are superficial and 1 that is deep. Now, on the medial side, the dorsal venous arch is going to empty into this structure right here, which is the great saphenous vein that extends all the way up to the thigh. I'm going to show you guys how it's going to extend all the way up to the thigh. And then on the medial aspect, on the lateral aspect, it's going to extend into another superficial vein, which is the small saphenous vein. Wait, hold on a second. Yes, this is the small saphenous vein, which is going to extend all the way posteriorly to empty into another deep vein. And then anteriorly, it is going to empty into a deep vein, which is the one right in front of us now, which is the, which is the anterior tibial vein. So again, every single deep vein of each toe is going to empty into the dorsal venous arch. The dorsal venous arch is going to empty into 3 veins. 2 of them are superficial, one lying on the medial side, which is the great saphenous vein, one lying on the lateral side, which is the small saphenous vein, and one lying anteriorly, which is the anterior tibial vein. Moving on to the plantar aspect of the foot, or the sole of the foot, we can see another venous arch, which is this one right here, which is called the plantar venous arch. The plantar venous arch is going to ultimately give 2 branches, which are the medial plantar vein and the lateral plantar vein, which are going to also correspond to the medial and lateral plantar arteries. The medial plantar vein, which is like a hint, is the present of the big toe, is going to continue and drain into a posterior structure, or a posterior deep vein, which is the posterior tibial vein, is the one that is in purple right here and extends up into the popliteal fossa. And the lateral plantar vein, I don't know why here there is no connection, but there's supposed to be a connection between this vein and the lateral plantar vein. But here, it's not present on complete anatomy, we're just gonna imagine that there's a connection between these two. So the lateral plantar vein will ultimately drain into this structure right here, which is the fibular vein. Now the fibular vein is going to lie on the lateral aspect of the leg, and it's like indicated by the presence of the fibula, which lies laterally. So now again, quickly, let's recap the plantar side. We have a plantar venous arch. This plantar venous arch has a medial plantar vein and a lateral plantar vein. The medial plantar vein will drain and continue posteriorly as the posterior tibial vein, and the lateral one is going to drain laterally as the fibular vein. Now the posterior tibial vein, the fibular vein, and the anterior tibial vein, all of them are going to drain into a single deep vein in the popliteal fossa, which is this vein right here, which is the popliteal vein. Those 3 deep veins, in addition to the superficial vein, which is the one right in front of us, that extended from the lateral side of the foot, it's going to empty into this popliteal vein. The popliteal vein is a deep vein, and then itself is going to empty into another deep vein and like almost lies anteriorly, which is the femoral vein. So the femoral vein is going to receive venous drainage from the popliteal vein and from the other superficial vein that we mentioned that traveled medially, which is this, which is the great saphenous vein. So the great saphenous vein carried the venous drainage from the dorsal venous arch, and also drained the superficial compartments and moved upwards and emptied into the femoral vein. The femoral vein also received the venous drainage from the popliteal vein, and then took both of these venous drainage and ultimately emptied them into the external iliac vein, this one right here, after it passed under the inguinal ligament. Coming back to the last part of today's video, which is a quick comparison and similarities between the upper limb and the lower limb veins. The great saphenous vein, which is the one right here, is going to correspond to the cephalic vein in the upper limb, as both of them are going to arise from a dorsal venous arch, and both of them are going to drain into deep veins at the root of a limb. A root of a limb, like you can see here, that the great saphenous vein will ultimately drain in the femoral vein, and the femoral vein is at the root of the limb, so the limb starts from here and goes downward. Similarly, the cephalic vein is going to pierce the clavipectoral fascia, and then it's going to ultimately drain into the axillary vein, which is also a root of the limb itself. However, you could see that the great saphenous vein lies medially, while the cephalic vein lies laterally. This is due to the reverse rotation during the embryo development. So you know how your thumb lies laterally and your big toe lies medially. So the same thing, as the reverse rotation of the upper and lower limb, one rotated laterally, the upper one rotated medially. So the great saphenous vein and the cephalic vein, one lies medially, one lies laterally in different limbs. One in the leg and one is in the arm. Now moving to the small saphenous vein, which is going to correspond with the basilic vein, as both of them are going to drain into a deep vein. They're also arised from a dorsal venous plexus. However, this deep vein is going to be at the proximal root of the limb. So one of them is at the root of the limb and one is at the proximal side of the limb.